Hello, everyone. Thank you for joining us for our monthly Strengthening Families Networking webinar. We are focused today on supporting kinship care providers with a protective factors approach, and excited to hear from hopefully a lot of you. We'll be jumping into the conversation about what you're doing to support kinship care providers in your jurisdiction or in your community. So what we'll be covering today, I'm Kaylin O'Connor. I'll be sharing some updates from the Center for the Study of Social Policy. We don't actually have any updates today, as we often do, from our partners with the National Alliance of Children's Trust and Prevention Funds, but another of our national partners is on to share. Our Mosaic Network partners will be talking about their Strengthening Families Evaluation Portal and some improvements and exciting developments in that portal that are coming soon that you can get engaged in. And then we will get into our main topic of the day about supporting kinship care providers. So without further ado, I will jump right in. That's me, sharing some updates from CSSP. So a little bit about these webinars, in case some of you don't normally join us. We do this once a month. It's an open invitation to anyone who's using the Protective Factors Framework and coordinating Strengthening Families efforts, whether that's in a program, in a community, in a state, an agency. We jointly convene these between my organization, CSSP, and the partners I mentioned earlier, our National Alliance of Children's Trust and Prevention Funds. Each month we have a topic and have guest speakers usually or a facilitated conversation. I always welcome your suggestions for what those topics should be or volunteers to organize or facilitate the conversation or to present information from your work. And you can always find recordings and materials from the past webinars posted on this Google site that's maintained by the National Alliance of Children's Trust Funds and actually has a rich archive of all these webinars we've done going back years. So take a look there if you ever miss a month or if you hear about a topic that was covered in the past, you can find the content there. I will also mention that you probably got the Strengthening Families e-update newsletter, which is why you registered for this webinar. But though that newsletter always announces the upcoming webinar and has a link to where you can find the recording of the previous month's webinar. So that newsletter is where you can get connected into all of what's going on with these webinars. So what do we have coming up for topics? We do this on the second Thursday of each month. In November, we are going to break that rule and do it on the third Thursday because there is a National Alliance meeting happening on the second Thursday, which is involving not only a lot of the people who usually participate in these webinars, but also those who are presenting. So we moved it to November 16th. I know that still clashes with the NACI conference, but it's hard to find dates in the fall where someone's not having a conference. So we'll do that on the third Thursday. Our focus will be on essentials for childhood and strengthening families. So that's the framework from the Centers for Disease Control and Prevention, really taking a public health approach to preventing child abuse and neglect by supporting safe, stable, nurturing relationships and environments for young children. And about 3 years ago, we did a webinar about how the essentials work connects with strengthening families work. We do have a handout on that, which is there on the slide under the background list. Sorry, background point there. And so we wanted to check back in on sort of how states are using essentials, and in particular, given the focus of our webinars here, how people are using that with their Strengthening Families work. So we're going to hear from the CDC and then from the folks implementing essentials in Washington State and Massachusetts. So really looking forward to that. And then on December 14th, we're back to our second Thursdays, and we'll be hearing about Strengthening Families Kentucky. We're going to start doing this every once in a while, sort of focusing in on one state and all that they're doing around Strengthening Families. Kentucky is one of our newer members of the Strengthening Families Network, and they have been enthusiastically finding ways to integrate protective factors work into a lot of their systems. So we're going to hear about what they've been up to. And then I just put the dates for the first few months of 2018. We'll announce those topics as they get closer, but go ahead and put that second Thursday of each month on your calendar. Okay, so I have a few updates to share from CSSP. We just put a new blog post up last week about gender, sexuality, and parenting. In this era when we've seen a lot of rapid change in social norms and acceptance and some backlash on that acceptance, we thought it was important to address some of the questions that come up about parenting. When children's gender expression is different than expected, when teens or young adults are coming out as lesbian, gay, bisexual, transgender, and when parents themselves are gay or transgender, and decided that we wanted to talk about how protective factors play into that. So whatever type of program you work in or where you encounter families, some of the families that you work with may be navigating these issues, and the supports they need are not fundamentally different from what any other family needs, but as they are navigating these issues, there might be particular supports that are useful. So we go through each of the protective factors and talk about some of the supports that families would need in that situation. I would also mention, for those of you who are part of child welfare systems, we refer in this blog post to one of our other projects at CSSP that's called Get Real, and that is all about how we can support all youth in the child welfare system to be REAL stands for recognize, engage, affirm, and love. So to have children and youth be recognized, engaged, affirmed, and loved for who they are, and not be damaged by their interaction with the child welfare system. So if you are part of a child welfare system, I encourage you to check out the blog and go on to the Get Real page to learn more about that work as well. The other big news in Strengthening Families land right now is that we are doing a large survey. This is a survey of anyone using the Protective Factors Framework, and that link is there on your screen. It's a pretty easy one to type in, but I will also put the link up in a moment. It should take 10 to 15 minutes to respond. I think most people have been taking around 10 minutes. And 3 of the people who respond will be randomly selected to get a 30-minute phone consultation with me about your Strengthening Families implementation. I just really want to encourage you to fill out the survey yourself and also to share it with others in your field. So I'm going to take a little time to talk about what the survey is all about so you feel more confident sharing it with others. The survey covers how you're connected to Strengthening Families and where you're implementing it, sort of where geographically as well as what kind of system or systems it's in, what training curricula and other Strengthening Families tools you use, and where you see a need or an opportunity to use Strengthening Families in new fields or settings. We also want to know if you have evaluation findings. I think there are more out there than I'm aware of, and I'd love to have people share those with us. So if you've evaluated your Strengthening Families effort, you could tell us about it there and send me more information. And I'll also say if you don't have evaluation findings or you're not particularly thinking about new areas to implement Strengthening Families, that's fine. We still want your survey response to tell us about how you are using Strengthening Families and what are we going to do with this information. So this is the first time that we've done such a broad survey. We've typically gotten information from state leads about how their states are using Strengthening Families, and we are continuing to get that information. So if you're a state lead, remember you've got additional information to provide. But we wanted to get beyond that so we could reach people who are in states that aren't part of the Strengthening Families National Network or don't have an active state-level initiative, but we know people are still using the framework. And we want to find out where there's a lot of interest and momentum as we think about next steps for Strengthening Families, where we think about what do we need to be focusing on, what do we need to do more research on, what do we need to be writing up and bringing people together to learn about, who should we be connecting, and also what kind of results have people found from their Strengthening Families work that we can start to look across what everyone is doing. So in case you can't tell, I'm pretty enthusiastic about the survey. I really hope that a lot of people will respond. Someone just posted a question. Kate asked, how long will the survey be open? It will be open until November 3rd. So a few more weeks here. And please respond. You might as well respond today, but feel free to put it on your to-do list if today doesn't work for you. All right, and let me know if you have any questions about that. In conjunction with that survey, we are also, let me back up. There's one more question from Rajel Kraft in Pennsylvania asking, will there be a way to get that information back by state? And yes, someone else already requested that, and I said, of course, we can filter by which state people say they're coming from, so that as a state lead, you can get information about who responded saying they're using Strengthening Families, how they're using it, and all of that. And we will then get that state by state back out to the state leads, but we'll also share in aggregate sort of what we learned from the survey. So the other thing that we're doing at the same time is looking at updating our Strengthening Families Speakers Registry. This is something that we started probably 2 or maybe 3 years ago because we get a lot of requests at CSSP for, we're doing a conference and we want to have someone come and do a session on Strengthening Families. Who would you recommend? And depending on where that request is coming from, sometimes I can make a really strong recommendation, and sometimes I'm not sure who's nearby or who would have expertise on the particular topic that they're interested in. So we started with this list that a lot of people put themselves on, but it's been a few years and we haven't updated the information, and so we want to make sure that it's still up to date. Also, we had a lot of states that didn't have anyone entered on the registry, so we're hoping to get a more robust spread across the country this time. And if you are currently listed, I will be sending an email in the next couple of days with instructions for how to get yourself on the new version of the list. But you're welcome, if you haven't done that before, to just go ahead and put yourself on. So you can go to this link, which I will also put in the chat box in a moment, once I'm not talking, and you can list yourself. So the idea here is you say who you are, where you are, your basic contact information, email address or phone number, however you prefer to be contacted, and then which areas related to Strengthening Families that you have some expertise in or would be willing to speak about. There's also a question about any additional information you'd like to share, and whether you are a certified trainer in a particular curriculum, as well as whether you're able to present in a language other than English. So lots of good information will be on there. So the next time you're looking for a speaker, you'll know right where to look, and hopefully a lot of people will get themselves onto that list. Okay, I'm going to hand over to my colleague Tori Monich from the Strengthening Families Evaluation Portal at Mosaic, and Tori's going to talk about some of the exciting developments there.
Hi, my name is Tori Monich with Mosaic, and we offer the Strengthening Families Evaluation Portal. Are family partnerships an indicator of quality in your region? Slide, please. We at Mosaic are committed supporters of the Strengthening Families framework. We're national partners with the Center for the Study of Social Policy. We've developed and supported 3 versions of tool sets for programs and states. Thousands of programs benefit from the online data system across the country, and we're always listening to your challenges and evolving with you as you integrate the framework into your communities. Slide, please. Slide, please.
I'm sorry, Tori, my screen got messed up. Getting back to your slide here. Sorry about that.
No
there you go.
No problem. Yeah, there we go.
Should be advanced now. There you go. Sorry about that.
No worries. Family partnerships are included as QRIS indicators in 90% of center-based and home-based ECEs across the country. Slide, please. Mosaic, we've been on a bit of a listening tour. We have conducted research interviews, focus groups, and some surveys, and we always want to understand which challenges are becoming more significant for you as you integrate the framework into QRIS and your communities. The pervasive theme that has emerged recently is how can I sustain a high-fidelity Strengthening Families implementation across all programs in my community once the trainers have left the room. Our response is to develop the next generation of the Strengthening Families Evaluation Portal, the Impact Hub. This will be online data, reporting, and training tools to help you integrate the protective factors into your QRIS and into your communities. The Impact Hub will be the result of all of the listening that we've been doing. It will be a community hub of data, results, and insights across multiple programs designed to demonstrate and improve the impact of multi-site initiatives and serve as a resource for implementation, ongoing practice, and evaluation. We've heard several themes emerge from our research tour. One is that we know that you want expert resources to help you integrate the framework. So we are integrating a resource library into the Impact Hub to help facilitate that. We know that you each have so many successes, and yet you also want to learn from each other's successes. So we're developing a peer-to-peer story bank to help facilitate that kind of communication between folks who are on the ground implementing the framework, whether it be at the program level all the way up to the state and regional view. We know that you want to continuously improve quality in your region. We have a feature called the Action Plan in the Strengthening Families Evaluation Portal. And in the Impact Hub, we're making that feature more robust by adding informational graphics and email alerts to help you continue to improve on the action plans that you create. As mentioned, many of you will need to report on progress for your QRIS. So we're developing a QRIS report specifically to address that need. We know that especially at the state and regional level, you want to integrate with existing data systems such as iPinwheel or your state's QRIS. Therefore, we're making it easy to facilitate seamless data sharing between the Impact Hub and your other data systems. We know that especially at the state and regional level, you want to engage programs. The Impact Hub will be a hub to promote the collective impact of multi-site initiatives. The Impact Hub will be releasing in January of 2018. We'd love to hear more from you. Please sign up to contribute to the development of the Impact Hub. We'll be sending out our own survey very soon. Please respond to the survey before November 1st to qualify for a complimentary 3-month membership. We love to hear from you, and we look forward to talking with you soon. Thank you so much.
All right, thanks, Tori. So keep an eye on your email, everyone, for that follow-up survey from Mosaic that will help you give you a chance to be part of developing those great new resources. So with that, we're going to get into the core topic of the day, which is about supporting kinship care providers. And unfortunately, our federal partners who were going to present on this information were not able to join us to present it, so they shared their information with me, and I'll be presenting it, talking about some of the needs of kinship care families, a couple of recent federally funded projects. I'll share our CSSP's protective factors tips for kinship care providers, and then we'll get into a discussion about how you're supporting kinship families. And I'm excited that we have some partners from Arlington County, Virginia on the line ready to share what they're doing, and then I hope that a lot of you will jump in with your own work as well. So let me quickly say before we get started that you can always type a question in the question box. And you can also raise your hand within the webinar system if you'd like to speak. If you raise your hand, then I can unmute you and you'll be able to speak. So if you have a question, you can type it in, or you can raise your hand and we'll get to you when we get into the discussion section. So let's share a little bit of the background information about kinship families. Kinship families is a broad term used to describe grandparents and other relatives who care for children when their own parents are unable to care for them. We know that in the U.S. there are 7.6 million children who live with a relative who's the head of the household. Some of those, the parent is also a member of a parent, or parents are also a member of that household. But we know that 2.6 million children are being raised by a relative or close family friend and do not have a parent living in the household. We also know there are 127,000 children being raised by relatives who are also foster parents. So that gets us at some of the numbers. Although, as you'll see, we're going to talk about the different types of kinship care arrangements, and you'll understand why it can be hard to pin down the numbers exactly. So informal kinship care is an arrangement where parents and family members agree for a relative to take care of the child, but there's no involvement from public system in making that arrangement or providing legal custody or guardianship. Temporary guardianship is when the parents are planning ahead for their children to live temporarily with a relative and will work with an attorney to get temporary guardianship assigned to the relative. Voluntary kinship care is when children are living with relatives with some child welfare agency involvement, but the state hasn't taken legal custody. So typically this might mean a child welfare case was opened and the parent agreed to have the child live with a relative temporarily while they maybe seek substance abuse treatment or otherwise address concerns while they're not able to care for their children. Then we get to formal kinship care, which is where the children are placed in the relative's custody. Well, they're placed there in the custody of the state by a judge and then placed with kin. So this is where the children were on track for foster care and a relative was located or volunteered to take them in. And guardianship can also be granted by the court to a relative caregiver to take care of a child on a permanent basis when they leave the foster care system. So these are a lot of different arrangements that can result in a child being cared for by a relative. The timing, the duration of that placement can vary a lot, whether there's legal systems involved, formal systems, or not. But in all these cases, these families have particular needs that are not the same as foster parents and not the same as biological parents or adoptive parents. So I think our systems are paying increasing attention to these types of arrangements because they are becoming, I think, more prevalent, and also because we recognize that when children are able to stay within their extended family, we believe that has benefits to the child, but our systems are not always set up to support that as well as it needs to. So what are some of the barriers and opportunities for informal kinship providers in particular when that legal status is not established? There can be challenges with health insurance, and getting legal custody can solve that so that the caregiver's own insurance can cover the child. The children in these situations may also qualify for the Children's Health Insurance Program. Side note, we need to make sure that there still is a Children's Health Insurance Program going forward, but in most states they should qualify. We just need to make sure that federal program gets reinstated soon. So there can also be mental health issues where, of course, insurance issues come up again, both in terms of having coverage and then whether that includes mental health coverage and whether providers are available. Many communities do offer support groups for kinship parents or kinship families to help them deal with the issues that come up as they navigate this taking care of a relative child. Of course, there are financial needs when a new child joins a household, and the concrete services available vary a lot by state. Families can access often a temporary assistance for needy families, child-only grant, and we'll talk a little bit more about how that connects in with the child welfare system and some of these federally funded programs. There can be legal issues around enrolling children in school, authorizing medical treatment, and either the parent needs to be engaged enough to still be carrying out those tasks and giving those permissions, or some kind of arrangement needs to be put in writing so that the relative caregiver can make those decisions and give that consent. Along with school enrollment issues, there can be issues about special needs of the child that the kinship care provider may not be aware of, or that if you're moving into a different school district, the school or district may not be aware of the child's needs, and the kinship care providers may need some support with navigating IEP meetings and advocating for the child's needs in school. So we have a few different federal funding programs where kinship care providers have been getting special support. So there were grants given between 2009 and 2013 for what were called Family Connection Grants through the Fostering Connections to Success and Increasing Adoptions Opportunity Act of 2008. And those were demonstration projects focused on Kinship Navigator, family finding, so finding the families when children are involved in the child welfare system, using family group decision making that incorporates extended family, and finding residential family treatment programs so that children can be with their parents while they get treatment. So some of these Kinship Navigator grants funded by the Children's Bureau were focused on assisting kinship caregivers to find and use the programs and services they need. Excuse me. A lot of these grants focused on programs that use a collaborative approach between TANF and child welfare. As I mentioned earlier, families in this circumstance can apply for TANF for the child, and sometimes either the child welfare system needs to let them know that they can do that, or by their application for the TANF program, that can alert someone to the fact that this is a kinship situation and they might be eligible for other supports and services. So focusing on that collaboration is important for identifying the families that need support and then helping them get it. These grants were focused on child welfare outcomes of safety, permanency, and well-being. And you can see the findings at the childwelfare.gov website. I should point out that if you look in the handouts of this webinar, you can actually download the slides, and there you'll be able to click on the links, where I know it's frustrating you can't click on them on your screen. So those were the Kinship Navigator grants from the Children's Bureau. Here's some of what those programs did. It was information and referral services that took different forms in different communities. Referrals to access a variety of services like legal services and activities for children. Assisting caregivers to understand foster parent licensure and applying for that TANF child-only grant that I already mentioned. The Navigator programs did focus on increasing family protective factors, family support, social support, and caregiver and child's well-being. Some of the programs had peer kinship navigators to help newer kinship providers find out about community resources available. And again, there's collaborative partnerships to ensure early identification of kinship families. These are some of the programs that were funded through that. Unfortunately, there were links in the slide that was sent to me, but they were not working. They had gone away. So you'll have to Google these if you want to learn about them, or go to that page that has all the examples from the Navigator programs on the childwelfare.gov website, and you'll be able to learn more about each of these programs. As you can see, they're spread across the country, and some were at a local level, others were statewide. The other type of federal funding serving kinship families comes through CBCAP, the Community-Based Child Abuse Prevention Program. So a few examples, in Illinois, the Parent Place is funded through CBCAP, and this includes comprehensive services for kinship caregivers with legal advocacy, telephone support and referrals, walk-in services, and a bi-monthly educational support group. Sorry, twice monthly. I said that wrong. In Georgia, Georgia State University implemented a grandparents raising grandchildren service that was case management, referrals, education, support groups, screenings, and other supports. And in Massachusetts, some of the family centers facilitated grandparents groups or grandparents raising grandchildren groups where grandparents could connect to each other, share concerns, learn about resources, and get support from each other. So here are some of these references to find out more about those particular programs. And if anyone's on the line who has insight into these particular programs, if you're in one of the communities where these were carried out, I hope you'll jump in and speak up as we get into the discussion section. I do see that someone has raised their hand, so let me check who's raising your hand. Oops, it's jumping around. I see that Kyle Britt has your hand raised. I'm going to unmute you and see if you are able to speak. Kyle, are you there? Okay, looks like he muted himself, so maybe that was an unintentional hand raise or not quite ready to speak. Sorry about that. Okay, let's move along. I wanted to share a resource that we developed at CSSP, Taking Care of Yourself, Tips for Kinship Care Providers. This is also available in the handout section on the webinar panel. We developed this in partnership with a working group that met for a couple of years, focused on strengthening families and child welfare. That group developed a number of tools for supporting child welfare caseworkers to implement or integrate a strengthening families and protective factors approach into their work at different stages in the process. And then there was a handout developed for tips for foster care providers, foster parents, for taking care of yourself. And we at first thought this would be relevant for any resource parent in the child welfare system. And then as we looked at it, as the group gave feedback, we thought for kinship care, there really are some additional considerations. And so part of that was wanting to make sure that people who were not doing kinship care through the formal child welfare system would still feel this applied to them. So if you call it foster parents and kinship care providers, they may not feel it quite applies. But also because some of the issues are different or can be different. There are some more complicated relationships to navigate in the extended family. For example, other extended family members who may think they should be the one providing kinship care, or who may not think the child should be in kinship care. The birth parent and the kinship care provider relationship may be positive going into this or may not be, and it can be difficult to navigate. Also within the family of the care provider, there can be conflicts, you know, a husband and wife where they're caring for someone's niece or nephew, and the other one who is not their own biological niece or nephew may have some resentment or concerns around entering into that kinship care relationship. And so some of it is different from a typical foster care arrangement, and we wanted to acknowledge that. So this handout focuses on the protective factors of the care provider and what they can do to support the child's social and emotional competence. We did work with our Youth Thrive colleagues who are implementing the Youth Thrive initiative, which focuses on protective and promotive factors for older children and youth. And we cross-branded this tool, so it does apply regardless of the child's age. And we also included a trauma tip related to each protective factor. So I'll say a little bit more about that. First, I'm going to show you what the tool looks like. So it's a handout with one cover sheet and then a page about each protective factor. And for the page about each protective factor, we define the protective factor in everyday language. We have some reflective questions related to that protective factor. with room to maybe make some notes and think about, on this page, for example, help you think about your own resilience and how you can stay strong. So to make some notes to yourself or just reflect on those questions. And then the trauma tip at the bottom. And we thought this was important, not just because we are, excuse me, we're all learning so much more about how much trauma matters, but also because for anyone who's caring for a child who's had traumatic experiences, your parenting experience from other children may not apply. Your trusted tips and techniques may not work as well when a child is responding to trauma they've been through. And it can be a little bit of a sensitive issue to suggest that the child you're caring for has been through trauma when they are a member of your own family. That can be difficult to confront. But even the fact that a child has been removed from their home and is adjusting into a new family can be a traumatic experience regardless of what the circumstances are that brought them there. So being aware of trauma and for us as professionals interacting with these families to be sensitive that it may take a while for the family to come around to recognizing that this child has been traumatized, but then to also help them deal with that in a way that's going to work for them and for the child, to have some empathy and compassion for what this child has been through and why, for example, traditional discipline techniques may not be working as well. So there's a trauma tip for each of the protective factors, and we really appreciated the input from that working group that worked through this, including people who support kinship care providers, at least one person on the group who had been a kinship care provider and was really able to share some of that insight about the particular challenges that can come up. So I hope that's a tool that a lot of you can use. I know this is one tool that I, as someone who works on strengthening families all the time, this is one tool that I actually have given out in my personal life. My hairdresser, a parent at my child's school, where I said, you know, this, I know you're caring for this child, this might just be really helpful. So it is really written for a parent audience and hopefully something you can find useful through your programs or just for people you know who are in this situation. Okay, so we're going to hear a little bit from Arlington County and then hopefully from more of you about how you're supporting kinship care providers and whether that includes a strengthening families and protective factors approach or not, but just how you're meeting the needs of these families. So let's go to Arlington. I'm not sure who's going to speak first. We've got Lissa Friedman, Kim Bonham, Rhonda Bradley, and Sherry Brothers on the line. Who would like to jump in?
I'll start, Kaylin. It's Lissa Friedman.
Hi, Lissa.
Hi. So just to give sort of like a context, and then maybe Kim could talk next about, she's our resource team supervisor, so she does a lot of the hands-on support for our kin providers in training and licensing. But just to give a context first, in Virginia, we don't have guardianship in the way in which some other states might have it, that kin can be providers and get a guardianship stipend. In Virginia, kin need to be licensed as foster parents, just as anybody else is licensed. So we've needed to make some adjustments to the way that we license them to take into account the differences between sort of traditional foster care and kinship care, because there are differences. So, for example, we have a kinship assessment, and the intent of it is to sort of guide us through the pieces of approving kin in particular that might come up that might be different than a regular foster home. So you might, I don't know if the listeners are familiar with Joseph Crumbly, with Dr. Crumbly and his work with Kinship Care, that he talks about the clinical risks that come with kinship care and normalizing them. So, for example, if he talks a lot about guilt or loyalty, grandparents might face challenges in keeping their own daughter or son away from the house, for example, away from seeing their child because it's not safe. That's not something that a traditional foster parent would be facing. They would have no problem telling the parents not to come over their house. They probably wouldn't even give their address out. So when we talk to kin about becoming foster parents, we need to talk about those things and normalize that it's a challenge, that it's hard, it's something that they might even struggle with and might not even do exactly as we ask them to right away, but we have to understand that that's a different kind of risk. So our kinship assessment is set up to address those things. And our licensing process, we have a separate class called Traditions of Caring that is for kinship providers. So even though they have to be licensed as foster parents, the process they go through is a little bit different. I don't know, Kim, maybe I should stop there. Do you want to talk about how those things are different? Because you do both, so you would know best how to describe those specifics.
Sure. So the Traditions of Caring is a curriculum that really caters to the kinship experience, and it's set up in such a way that even in the language that we're required to use when we're facilitating the training is to not call them sessions like we would, for example, in a traditional foster parent training, but we're supposed to call them meetings, because we're drawing on the experiences of the kinship providers in the room, some of who have not cared for their relatives yet, but all come with the fact that they're all kinship providers or related to the children that need care, and they have experience, and the curriculum encourages us to draw on their experience to help bring forward issues that they may experience, such as behavioral challenges for children who have experienced trauma. Here in Arlington, we partner with some other jurisdictions to conduct our training, which really supports our trainings being full, and we really rely on the participants who are in the training to give their feedback and their contributions based on their experiences. And Alyssa mentioned how we've been consulting with Dr. Crumbly, and one of the things that we've noticed that when we're conducting Traditions of Caring is often that first session we have a lot of angry participants, which might seem a little odd. Everyone's willingly come to the training, but sometimes the families are still very angry, very confused about why their relative is in care, and we actually, through the work with Dr. Crumbly, have been able to see that anger, especially in the first session of that Traditions of Caring, is not pathology. I mean, it's really based on their confusion about why their relatives are in care, their experiences with a Department of Social Services, or their concerns about what our roles are, and being able to shift some of our thinking about how to view the kinship providers as versus how we would view non-relative families when we're training them has been very helpful.
So the other thing that we have in Arlington is the ability to do emergency approvals. So we can we have to license the kin, but they give us permission to do it really quickly, like do it immediately as an emergency. So if it's after hours and mom's been arrested and grandma comes and says, I'll take the child, we can place the child with the grandmother only because we are calling her foster parent and we're giving her a license. And we go out to the house and we do a check of the home and make sure that there's space and it's clean and there's furniture, and that we check to see if she has any criminal background and the bottom line safety things. But if we place the child that night, if we take custody from the parent and place the child with the grandparent, for example, we have to call that a foster parent placement. We have to call that grandparent licensed. And then we have 60 days to go through the licensing process. And if for some reason they become ineligible or they change their mind, then that child would have to move. That's the way Virginia is structured, but they do allow us to do emergency approvals. What we're trying to do right now is I'm negotiating with the state to start to give us financial support to have a kinship navigator in Arlington so that we can begin to provide extra support to those kinship placements, because there is so much going on. As Kim described, there's anger, there's fear, there's confusion, and then there's just concrete logistics of how in the world am I going to make this work financially, and and what are my legal rights, and we need to be able to support our kin, and the navigator, that would be a perfect role for the navigator.
Great. Thank you, Linda. Yeah, I think so far we don't have any questions coming in, and I think what you're sharing is really helpful and valuable. So why don't you keep talking about what you're doing in Arlington? We do have one question that I'll get to a little bit later. So go ahead and share a little bit more. Is there a protective factors element to how you support the kinship providers?
There is. I mean, I think that the messaging out to all of the foster parents of the Kim, do you want to talk about the way in which we've used sort of the protective factors to frame some of the information we've sent in our newsletter?
Yeah, sure. We have a monthly newsletter that we send to our foster parents that informs them of the activities that we have for the month, be it in-service trainings or events in our community that are free and available to them. But one thing that we've done is we've featured a protective factor for a month, for example, and we feature a particular foster parent who we feel has used protective factors, for example, concrete supports, and we'll interview and talk to a foster parent and let them know they're going to be featured, and we'll talk about how they've used that protective factor in their work as a foster parent with supporting the birth parent or working directly with that child. And that was our way of, one, making sure our foster parents were aware of all the protective factors, but also letting them know that they're, sometimes even without knowing it, that they're using protective factors in what they're doing with the children and families that we serve.
And then the other thing that we've, I'm going to ask Rhonda Bradley, who's also on the phone. She's our family group decision-making in Virginia. It's family partnership meetings. She's our program manager for that. And we've been making some adjustments to the way we do our family partnership meetings to address the needs of kin and the risks that are associated with that, and then the strengths in terms of the protective factors. So, Rhonda, can you talk a little bit about what we're doing with family partnership meetings now in order to address those things? Rhonda? I see her name up there, but maybe she's on mute. She's, I'm sorry, she's trying to call in. I think she's probably not able to connect to the.
I'll have her, yeah.
For Alyssa.
What's that? Hello?
Go get her. Come into my office.
Oh, okay. She's coming. Okay. All right.
Okay, yeah, we'll hear from Rhonda once she's in.
Yes. So I mean, we've this past year made a big push around Kinship Care, not just in Arlington, but we've also put together. I don't know, Sherry, you want to talk about the Kinship Symposium until Rhonda gets there? We're having trouble with our phone. Sherry? Okay. Well, we've also had, we have joined forces with the regions around us, Alexandria, Fairfax, Loudoun, and Prince William, to talk about kinship. Oh, here comes Rhonda. To talk about Kinship Care in the region. The reason why, I think Kim mentioned that we've done our training jointly because we're kind of small, so we don't always have enough kin to have our own group. So we do things regionally. We have regional committee meetings, and we have an annual now regional Kinship Symposium, which has been a great success each year. I think we've had 3 now. Sherry can talk about that in a minute, but Rhonda's here now to be able to talk about the ways in which we've been sort of rearranging the structure of our FPM, our family meetings, to accommodate the needs of kin and placement with kin.
So what we've begun to do is on our initial family partnership meeting where we may be looking at removing children or removal has happened, we're looking to utilize that meeting to plan around that alternative placement or kinship placement for the children, and then reconvene the meeting within 30 days to work on a reunification plan with families. We feel like it's a better use of the time to be able to expedite permanency for kids or returning kids to relatives if they've had to enter foster care by that 5-day hearing, if we utilize that time to focus on alternative placements. And during our coordination, what we're doing is trying to identify what barriers there may be to those placements and address those risk factors as risk factors during the meeting, and then work through those so that we can be aware not just what the risk factors are to the placement, but if there are any barriers that may need to be addressed so that we can be aware and also begin to work to reduce those barriers to those placements.
So if we know ahead of time, you know, as we're doing the coordination for the meeting, that there's an aunt that is, you know, a potential placement, but when we talk to her, we realize that she's, you know, she does not get along with the mother, and there's going to be friction in the meeting, and there's going to be friction about placements and visitation, then we'll know to address that in the meeting. We talk about it beforehand, and then we'll bring that up in terms of our risk and planning. We'll talk about that specific thing as a barrier and how we're going to get past it with this kinship placement. So we're trying to zero in on the kin pieces of alternative care because they are very different, and we're learning more and more, you know, every month of, you know, how different they are and how we can accommodate and implement changes. Sherry, are you there?
Yeah, I had gone to get Rhonda, so I'm sorry.
Okay. Can you talk about the Kinship Symposium a little bit, like what that was like this year?
Yeah, sure. So for the last 3 years, we've planned an annual Kinship Symposium, and it's a regional event that's really planned by 3 jurisdictions that are in this area. And our hope around that is that to get momentum built to the state, to get them to make some policy changes, and we're feeling like if we can do that from the ground, it may have to be like a groundswell from us up to them, because it isn't currently working in the opposite direction. So the Kinship Symposium, you know, is to educate the workers and any collaborative partners on different kinship issues. This year we were really fortunate because the state director actually came for the first session that we had for the Kinship Symposium. And what it was a panel from Allegheny, or well, it was from Pennsylvania. It was a state person as well as local people. And they were talking about how they've created a kin culture. And there's a WikiHow resource that's on the internet on how to create a kin culture, and they just talked about the different ways that they support their workers and also the families to help them with making kinship placements work. And so it was really effective to have the, we were really happy to have the state director there to hear that information. It was also they just had some ideas that we hadn't thought of before, so that was great. And then we had a second chance come and also talk about practice. And they talked about some ethical issues when working with kin, and just kind of along the same lines of creating the kin culture, but more so practice tips and tools. So that was something else that we had done this year.
That is all fantastic. Thank you all for sharing that. I think it's clear to everyone that you're really trying to understand and serve these families as well as you possibly can, and I hope that other jurisdictions around the country are doing as much as you are so that those families get the support they need and those kids get the care they need. So thank you very much for sharing that. We did have one question that comes in, and I'm not sure, I know I can't answer it, and I'm not sure if you can, but I'm going to ask. Kyle Britz asked for these the collaborations that were involving child welfare and TANF. So I'm not sure if you guys deal with that as much. But the question was whether we're addressing, quote, good cause in the event of VV risk for these TANF cases. Any thoughts there from Arlington? Or if anyone else is on the line and can type in an answer, that would be wonderful.
Well, I mean, we ask for good cause based on fiscal necessity. Is he asking whether or not we do it just because it's domestic violence?
I think that might be the question. If that's the good cause, is that enough?
We have not in Arlington made that specific connection in our good cause request. Okay.
Thank you. Yeah, he typed in yes, that was the question. Okay, well, sorry we couldn't answer that in more detail, Kyle. I think our federal partners who were involved in those grants would probably know more specifically what other jurisdictions are doing, and you may be able to learn that from the website that was listed there about, I'll go back to it actually. The site visit reports from the Kinship Navigator programs may have more information on that. So with that, I'm going to wrap us up. Thank you so much to our friends in Arlington County for sharing so much about what you're doing. That was really helpful to hear from on the ground and how you're really engaging with those families. And thanks everyone for joining us. And keep an eye on your inbox for the survey from Mosaic. And let me know if you have any questions. Have a great day, everybody. Thank you.
Bye.